Michael, let me just jump back to the homelessness crisis before we move forward, because I had forgotten to ask you about your 3 prescriptions. I know you have 3 thoughts. Number 1, we talked about shelter first, not housing. But number 2, I know you want universal psychiatry. Explain that.
Yeah, I mean, we have a broken mental health system, and we've been talking about it forever. But basically, there's 2 problems with it. The first problem is that there's a lot of overlapping systems. I mean, I would interview people on the street who I would say, "Do you have a social worker?" And they would be like, "Oh, yeah, I got like 2 or 3 social workers." Some of them had more than one place to stay. A lot of people on the street actually do have a place to stay, and they often don't live in it for a variety of reasons, often having to do with mental illness or the fact that they can't use drugs in the shelter. So the system is both overlapping, but also fragmented. People will often get out of rehab and then go right back on the street, and then often overdose and die because their bodies aren't used to the levels of drugs that they're doing. Other situations, people get out of prison and they don't really have anything, they don't have anything to go into. So you need to have a better system that is much more centralized and much more efficient. In California, I'm calling it Cal Psych, one-stop shopping for people, where there's just one agency that would oversee all these things rather than having it farmed out to a million different people. I also think we need universal psychiatry in the sense that we're in a mental health crisis as a whole nation. Obviously, social media is making people mentally ill, but we've also seen a big increase of kids who have been experimenting with pharmaceuticals, what they thought were pharmaceuticals, buying a half a Percocet or a half a Vicodin or something off of Snapchat, it being contaminated with fentanyl and them dying. So Snapchat is a big problem. They need to change their policies, but we also need to have a much more systematic national program of universal psychiatry for everybody, kids that don't seem to have any problems, but also people living on the street, because the current system is completely broken and fragmented. So that is one area where I do think we should be able to find, and I show in the book, a much greater amount of conservative and progressive agreement.
My pal Eric Bolling, formerly of Fox News, has been talking a lot about this since he lost his son Eric Chase to just exactly this kind of situation. It wasn't Snapchat, but thought he was buying one pill, and it turned out to be laced, and died that night. I mean, that's his thing. One pill can kill. That's what Eric wants all parents to repeat to their children. I've done it to mine many times. They can't be assured, because it's in pill form as opposed to something you snort or inject in your veins and appears to have come from a doctor at some point, that it's safe in any way. And I know that's not new for most of us, but for kids, my kids understand a pill to be medicine, right? They still understand a pill is medicine, and you kind of got to break them of that mentality.
Absolutely. Yeah, I mean, that's the bottom. I mean, it's sort of. I find it. I'm working with these parents whose kids have been killed by fentanyl or other drugs, and all of us are just sort of shocked that this is not a bigger national issue. It's like a third-tier issue, and yet 93,000 people killed last year. That's 5 times more than were killed in 2000. That's 3 times more people than die in car accidents. That's 5 times more people that die in homicides in a normal year. I mean, what more has to be done for us to draw attention to this? There's a lot of shame around this issue. There's a lot of shame around mental illness and drug addiction. But the fact is, it's a health and medical issue. We need to deal with it that way. There is a twist in the sense that we all have this experience often in our own lives of people that you have to stage an intervention for. And so for people living on the street, it's paradoxical, but to get them the medical care they need, they often do need to be arrested. You have many cries of help: shoplifting, defecating in public, using hard drugs in public, camping in public. These are all cries for help that we need to respond to. But we've become so kind of namby-pamby about this, and so sort of, the victimology, basically, this ideology that there's some people who only things should be given and nothing required, has really hijacked people's brains. And that's what's led to so much of the chaos.